It's time for Morning Rounds. An educational day for people suffering from joint pain is coming up pretty soon.
That's right, and this is for those considering planning or having hip or knee replacement surgery. And Dr. Robert Cusick with the Department of Orthopedics at Christie Clinic joins us live this morning to explain more details about that. Good morning, doctor. How are we doing today?
Good morning. Thanks for having me.
Yeah, you bet. Just to begin here, can you explain to us what a joint really is?
Joint, in essence, is just where two bones come together. It's usually the bones have soft or smooth ends that allow them to move against one another without a lot of friction.
And doctor, what's the main cause of joint pain?
Well, the most common cause is really wear and tear type arthritis, which is a process of the roughening of the cartilage, which in turn creates inflammation. And the inflammation is generally pretty painful and gets more painful over time as the cartilage becomes worse.
At what point should somebody having some of that pain reach out to you?
Well, we usually have first, second, and third line type treatments. First line treatments are things people can do on their own, things like activity modification, some anti-inflammatories, and then possibly ice or heat, whatever feels better. Second line is to see their primary care doctors, and primary care doctors can use prescription medicines, they can do injection therapy, they can utilize some physical therapy techniques. And when those things are no longer working very well, then we have people consider coming to a specialist like myself, where we talk about higher level treatments like specialized physical therapy. There are specialized medications that we can inject that aren't commonplace. And then the last line is sometimes surgery.
And when does it get to that point when you know that maybe surgery is the best option for a patient?
Surgery becomes the best option when all those treatments we're describing don't work very well, and when somebody's quality of life is really suffering because of that particular issue, like a hip or a knee that's slowing them down, when they can't keep up with their kids or grandkids, or they can't perform their work properly, or they are having difficulty sleeping because of these issues, then surgery might be their best option.
Doctor, can you explain to us what some of the most recent advancements are when it comes to joint replacements?
You know, the biggest advancements in the past 5 to 10 years are how fast we're mobilizing patients, meaning how fast we get them out of bed. It's commonplace nowadays to do a hip or knee replacement and have someone be out of bed within a few hours.
Wow.
And up walking with physical therapy. And nowadays, over the past year, we've really developed a lot more techniques in terms of outpatient therapy, trying to get people home the same day as surgery, which is something we wouldn't have even considered 10 years ago, but it's becoming very commonplace due to the hospital limitations and the ability for family to be near the patient. So a lot of people are electing to have their surgery and go home, and that leads to generally fewer complications because people who sit in hospital beds not doing anything are at a higher chance to develop problems like pneumonia or bed sores or things like that that we really want to avoid with these elective surgeries.
And I'm sure once a patient is made aware that they're going to start, get up and walk within hours, as you said. I know you mentioned a few of the reasons why, but why really is that so important to get moving right off the bat?
Well, you know, with what we do, bone heals best under a little bit of stress. So if we do a surgery and someone sits in bed for a month, they're not going to heal very well. So the faster we get people out of bed, the fewer problems they have with things like blood clots, infection rates are lower, pulmonary issues are lower, and so we have a much fewer complications if we have patients who are ready to have surgery and then after surgery are mobilizing very, very quickly.
Doctor, what kind of reaction do you get from patients typically before they go in and then after they come out, say, months after recovery?
Well, obviously a lot of people have a lot of trepidation about having a surgery, but some of the other advancements we've made have made the surgery a lot easier. The other things being what we call multimodal pain management, which is when we use pain medicine before, during, and after procedure in order to limit the pain they have going forward. So they are typically fairly apprehensive, rightly so, about having a large surgery like this. I'd like to say the most common, but the reaction I like the best after when they come in to see me a month later is that it was way easier than they had planned it to be, and all their friends who gave them scary stories were wrong.
And what's that feeling like for you, seeing somebody before they have the surgery and then seeing them with their follow-up appointment, really doing so well?
Yeah, it's incredibly gratifying to be able to do the work I do because we have people who come to see us who really literally can't walk and can't get through their house. And so when we're able to offer a treatment that helps them not have to deal with that problem any longer, it's really incredibly gratifying, and I feel really lucky to be able to help people like that.
Doctor, if people have questions right now and they'd like to reach out to you, what resources do you have that are available? How can they reach out to you?
Well, we have the Christie Clinic portal is an excellent way to get in touch with us. The website has ways that they can access us as well. And talking to their primary care doctor, they can get referred to see us at any time. We take all patients here in town. And what I appreciate about having people come to see me is there are definitely things that we offer that aren't offered elsewhere in terms of surgeries for younger people. So they can reach us through Christie Clinic anytime.
Great stuff, Doc. Thanks so much for your time this morning.
Thanks again for having me.
Thank you. Jack has your forecast next. We'll be right back.